Welcome to a MCCEE tutoring services video providing you with all of your USMLE and Medical Council of Canada exam content needs. As always, check the description below to skip ahead to the section you want. You can also check out my website for more tools to help you do well on your exams. Today I will cover Lyme disease. Lyme disease is endemic to the northeastern US and central eastern Ontario, as well as the Maritimes. However, it is expanding rapidly elsewhere due to climate change. There are also other species that cause it in Europe, Asia, and Africa. The most important thing to remember is that Lyme disease is the most common tick-borne illness, and there was a mothballed vaccine designed for it. Here is a map of the life cycle of the culprit tick, Ixodes scapularis, although there are some other species that you saw on the previous slide that cause it as well. The pathogen causing the disease has its reservoir in small mammalian rodents, in particular the white-footed mouse. Therefore, it is the dirty nymphs that are the vector. Keep in mind that ticks themselves have a neurotoxin that can cause tick paralysis that can rapidly cause respiratory failure, but this is caused by the neurotoxin in their saliva and not by Lyme disease. The tick needs to be removed for the tick paralysis to clear. Pathogenesis. Lyme disease is caused by the bacteria Borrelia burgdorferi. Unlike most bacterial infections physicians see, such as cocci, bacilli, rods, or a combination, these are spirochetes, like syphilis. I will let this image haunt your nightmares while I explain how the bacteria gains entrance to the human body. The tick burrows into the skin and begins to siphon blood, and at the same time some of its contents, such as its neurotoxin and possibly Borrelia, are mixed into the bloodstream. You can note just how small these suckers are. It can sometimes just appear like a new mole on the skin. Here you can see a brief overview of the signs and symptoms the disease produces. It is important to note that these do not occur all at once, but in stages, just like syphilis. So let's break the disease down into stages. So there are the three stages are early localized, early disseminated, and late disease. Early localized disease consists only of flu-like signs and symptoms, and in 80% of cases, erythema migrans, which is the target-shaped lesion shown here. This typically occurs days to weeks after the infection. Early disseminated disease has many feared effects and generally begins weeks to months after the initial infection. It can be due to immune reactions or the bacteria itself. First is the possibility of a lymphocytic meningitis. Second is unilateral or bilateral nerve palsies, in particular cranial nerve 7, known as the facial nerve. Remember, the facial nerve palsy is also known as Bell's palsy, and the most common cause of bilateral Bell's palsy is Lyme disease. A third possibility is third-degree AV heart block, although any heart blocks are possible. Treatment reverses the block in time, meaning a permanent pacemaker is not necessary. A fourth issue is multiple annular lesions, or in other words, multiple erythema migrans lesions. The fifth issue is associated with late disease as well, which is the migratory arthralgias. So in late disease, this occurs years after the primary infection and is associated with the arthritis, as in the previous slide, but also subacute encephalomyelitis, dementia, polyneuropathy, as well as a rare condition called acrodermatitis chronica atropicans. It is more common in women over the age of 40. It starts as a bluish discoloration with edema as the veins in the area become more prominent. So diagnosis is generally done clinically, but you can use ELISA followed by a Western blot for those living in an endemic area or have a recent tick exposure and have signs and symptoms of early disseminated or late disease. There's no need to screen people in endemic areas or those with the classic erythema migrans rash. Also, those with erythema migrans are likely to be seronegative due to the amount of time it takes for a person to seroconvert. So the treatment is doxycycline, with two major exceptions: children and pregnant women. And after treatment, there's no need to recheck the serology. So in terms of dosage, 100 milligrams PO BID for 2 weeks with early localized or early disseminated disease is fine, unless there are contraindications, in which case amoxicillin 500 milligrams PO TID for 14 to 21 days. If there are neurological signs and symptoms, treat with ceftriaxone, 2 grams IV Q daily for 2 to 4 weeks. And again, if the patient is allergic to the above, doxycycline 100 to 200 milligrams PO BID for 2 to 4 weeks can be used. The main reason why doxycycline is preferred is because of the potential co-infection with Anaplasma phagolyticum, which also uses the same tick vector. I will cover this in a later video. Prophylaxis. As I mentioned earlier, the vaccine for Lyme disease is not available anymore. But what if a person is bit by a tick? Do you start prophylactic treatment? You can give 200 milligrams of doxycycline PO as a one-time dose if the tick has been attached for at least 36 hours, tick carriage of Lyme disease in the region is greater than 20%. There's no contraindication to doxycycline, and if the antibiotic can be given in the first 72 hours. It's important to remember that the prophylactic treatment of Lyme disease is a number needed to treat of 400 to 150 people just to prevent one case of the disease. And also, just be sure to advise patients to wear pants and use DEET-containing repellents and check for new moles after hiking. Another issue to look out for is the Jarisch-Herxheimer reaction. Just like with syphilis, this reaction is possible here. You do not stop the treatment. Now the person may have a fever, which may be accompanied by headache, myalgias, rigors, sweating, hypotension, and the worsening of the rash if it was present. These symptoms often resolve without intervention within 12 to 24 hours. Let's do some questions. A 5-year-old boy from New England is brought into the emergency department by his parents after they notice a bullseye-like rash on his waist while bathing him. There was a tick at the center of it. He has also not been feeling well over the past couple of days and says he feels tired and has a headache. You diagnose him with Lyme disease. What is the preferred treatment in his case? You can pause if you need time to think. So in this case, amoxicillin is the preferred treatment because he's a child under the age of 8 years of age. Second question, a 14-year-old girl from Connecticut is brought to the clinic in June with fevers, malaise, and cough. She has no current medical conditions and she loves to go hiking with her parents, and last week she noticed a tick on her about a day after coming back from a hiking trip. CXR is negative for any pathology and CBC shows a hemoglobin of 140, WBC of 1500, and platelets of 132,000. Her liver enzymes are also noted to be elevated. She does not have a rash. What tick-borne illness is likely responsible? Again, if you need time to think, pause the video now. So in this case, Anaplasma phagolytocytophyllum is the likely causative agent. In future videos, I will cover the rest of the tick-borne illnesses, but it is important to keep other illnesses in mind when examining those at risk of tick infections. Also keep in mind when a question mentions the specific microbes, as in this question, think about the diseases they cause. For instance, Babesia microti causes babesiosis, which is a parasite similar but still very different from malaria. Anaplasma phagocytophilum is an agent that causes anaplasmosis, which is described as Rocky Mountain spotted fever without the rash. C is tularemia. D is Lyme disease. E is Rocky Mountain spotted fever. So in summary, Lyme disease is a summer disease with a tick-borne vector, I. scapularis, with reservoir of rodents caused by bacteria, Borrelia burgdorferi. It has 3 stages of disease: early localized, having characteristics of erythema multiforme rash and flu-like symptoms; early disseminated, characterized by meningitis, heart block, and cranial neuropathy, among others; and late disease, which is characterized by large joint arthralgia, subacute encephalomyelitis, and polyneuropathy, sometimes also dementia. Diagnosis is clinical, but can be done with ELISA followed by Western blot. Treatment is with doxycycline unless contraindications present, then use amoxicillin. Always advise people to wear pants, check for new moles after hiking, and wear repellent containing DEET. So this has been an MCCEE tutoring services production. For a link to the website, see the video description where you can learn more about what MCCEE tutoring services has to offer. Thank you and have a great day.